Whether it's convenience or for health reasons, the FDA reports that over 3/4 of all American women use contraceptives during their reproductive life.
Birth control options can come with progestin or estrogen or both.
The most commonly prescribed form of birth control is the pill.
Combined oral contraceptives that have estrogen and progestin components in it, and then there's a progestin-only pill. Depending on your situation, depends on which one that you might need.
This medication needs to be taken every day around the same time. If you're worried about not keeping up with your prescription, birth control options like an IUD take timing out of the equation.
So there's several of them on the market. The ones that we typically deal with here in the office are Mirena, Liletta, Kylena, Skyla, and the Paragard.
Kat says IUDs come in two forms, hormonal and non-hormonal.
Paragard is the non-hormonal IUD. It's also known as the copper IUD, and it's just a little device that's inserted into the uterus, and it looks kind of like a T, essentially like this.
As an intrauterine device, your provider will insert the little T into the uterus.
And depending on the type that you choose, it can, hormonal types are up to 8 years to prevent pregnancy. The copper IUD can be used up to 10 years to prevent pregnancy.
An implant is a similar option, but this matchstick-like contraceptive is placed under the arm.
And this is much like the IUD in that it's a progestin-only birth control, and it's inserted into the upper arm just underneath the skin.
Another form of contraception is the vaginal ring.
That can be inserted into the vagina, and it encircles the cervix, and it stays in there. Depending on your situation, you can change it every 3 to 4 weeks, depending on whether or not you like your menstrual cycle.
And there are external hormonal options too.
So the patch is a combined contraception, meaning it has estrogen and progestin in it, and you can place it several different places on the body, and you rotate those sites. So the abdomen, the buttocks, some people use the upper arm, some people use the back, and you change that once a week.
If you're okay with needles, the Depot shot might be for you. This is given once every 3 months.
It is a progestin-only birth control, so you're not getting the estrogen component there as well.
With so many options available, your provider can help decide what will work best for you based on your needs.
Do you wish long-term pregnancy prevention? Are you wishing to reduce the amount you're bleeding or potentially not have any periods at all?
Kat says it's important to note that these birth control methods won't stop sexually transmitted infections. To stop STIs and STDs, health experts recommend the use of barrier methods like condoms. For Arnot Health, I'm Lexi Cutmore.